Functional paraplegia. Functional paraplegia, functional quadriplegia. Functional paraplegia. Documentation of functional paraplegia can affect the length and risk of a patient's stay in the hospital, as well as its reimbursement. For example, if a person has spinal cord damage, he or she may be at a higher risk for readmission. If this is the case, determining the type of damage to the spinal cord and brain is essential to predicting readmission rates and maximizing rehabilitation. Functional paraplegia is caused by a combination of injuries to the spinal cord and brain. The more severe the injury, the more severe the paralysis. In addition to affecting the leg muscles, victims of paraplegia also experience extensive loss of sensation, ranging from tingling to complete loss of feeling. Consequently, the limbs of a paraplegic can be very difficult to control and maintain mobility below the level of the injury. Most people with functional paraplegia have a healthy set of legs. This type of paralysis is not congenital. Those who suffer from this condition usually have a family history of HSP. A neurological exam can help to rule out other diseases that cause similar symptoms. A neurological examination is the best way to identify the cause of this disease. During the examination, doctors will also rule out other conditions that have similar signs and symptoms. While there is no cure for functional paraplegia, it can be cured. Treatment for underlying conditions and proper therapy can greatly improve a person's quality of life. Many people who suffer from this disease experience intermittent or phantom sensations in the body and intermittent feelings in the lower half of their bodies. A professional doctor can prescribe the right therapy for an individual with this disorder. Nevertheless, treatment is only a short-term solution. The most important thing is to remain positive and determined. You may have to undergo physical and psychological rehabilitation if you want to live a healthy life. In most cases, the traumatic injury has caused damage to the brain and spinal cord. The affected muscles in the chest, diaphragm, and abdomen are affected. These muscles help the person breathe. If the person is unable to breathe, the symptoms of this condition will include a loss of sensation and a lack of strength in their legs. As a result, it may be hard to function without the use of their legs. In this case, the patient had an MRI scan, but he had no visible damage to the spinal cord. Although the MRI showed a non-displaced L1 fracture, the person did not have spinal cord damage. However, the patient was asymptomatic at the time of the injury and the MRI confirmed his diagnosis. While his condition may be progressive, the person will experience intermittent feelings in the lower half. They may also feel phantom or electrical sensations in their body. SEPs are another diagnostic test for functional paraplegia. This test is used to determine the cause of the disorder. This test is also helpful for identifying the type of neuropathology causing the disability. It is important to note that the cause of the paraplegia is important. It is important to find out whether the condition is due to a spinal injury, or from any other cause. If it is related to an injury, it will require surgery. A symptom of functional paraplegia is the loss of sensation in the lower extremities. Patients with this condition are unable to move below the level of the injury. Most of them have healthy legs, but they are still unable to move. Symptoms of functional paraplegia include phantom or electrical sensations in the body. Besides physical damage, other signs may also indicate a medical problem affecting the spinal cord. In most cases, functional paraplegia is caused by a spinal cord injury. It affects the ability to breathe. In addition, it can interfere with bowel movements and cause urinary tract infections. While it can be treated with antibiotics, intermittent catheter use can help to prevent urinary retention. Symptoms of paraplegia can be distressing, and people with this condition often develop a depression. It's important to seek help and support for the condition. Read this. What does functional quadriplegia mean? Functional quadriplegia, quadriplegics, quadriplegics.